Good morning. I'd like to ask you all to humor me first by closing your eyes and imagining a situation I'm going to describe to you. So please do close your eyes and please don't fall asleep. With your eyes closed, I'm going to ask you to imagine that you're the parent of a newborn baby. When she's 2 weeks old, she develops a fever, and naturally, as with any other parent, you're quite concerned about her well-being. You call her mother, your mother, and you ask her for advice. And your mother says, don't worry, newborn babies frequently get fevers. All you really need to do is to wait till the morning and she'll be fine. But come the morning, you discover that her fever's gotten much worse. She's now burning hot and she seems to be gasping for breath. With your eyes closed, I'd like you to imagine who you would go to seek help from for your baby and the sort of place that you'd go to for that kind of help. Imagine both the person and the place. Now, open your eyes and look at this image. I'm pretty sure that none of you would have imagined that the sort of person would be like the woman on the right-hand side in the orange sari. Yet, the woman on the right-hand side, whose name is Anjana, and she works in the villages of Gadchiroli, one of the poorest districts of our country, she's a community health worker who's been trained to diagnose and treat newborn pneumonia. Women like her are virtual lifesavers for tens of thousands of mothers in our country. Now, some of you may wonder, why do mothers in our country need to consult women like Anjana? Well, the answer is quite simple. Usually, it's because they don't have any choice. Either medical specialists are not available, and even when they're available, they're not accessible, either because they're too expensive or a number of other sorts of barriers. It is for this reason that the idea of task shifting was developed. The idea simply means shifting healthcare tasks from more expensive and specialized people in the community, people like doctors and other specialists, to more available and affordable people in the community, women like Anjana, the community health workers. This particular model of task shifting was developed by an NGO called Search. But they weren't only satisfied with promoting an ideology. What they really also wanted to do was to demonstrate the effectiveness of this particular model by carrying out what in medicine is considered to be the most robust experiment of all, the randomized controlled trial. And when they did that, they found that in those villages where women like Anjana worked, newborn mortality fell by more than 25% compared to the other villages. So impressive were the results of this experiment that the government of India scaled up this particular model of care called home-based newborn care throughout our country in the National Rural Health Mission. Now, how does this idea of task shifting relate to my work? Well, I, as you heard in my introduction, work in the area of mental health. And I suppose some of you must be wondering, how does mental health figure on the public health agenda of India alongside such pressing issues such as maternal and newborn health? Well, let me leave you with some headline findings that explain why. Mental and neurological illnesses, what we might perhaps call the brain disorders, account for about 10% of the total burden of disease in India today. Amongst these conditions, depression is the leading cause of the burden of disease alongside conditions like newborn pneumonia. Suicide today kills 2 times the number of people in India as does HIV/AIDS, and in fact is the leading cause of death in young women on par with maternal mortality. And if I had to assemble all these different brain disorders into one pot, then it would turn out that at least 50 million people, and that's a conservative estimate, in our country suffer from one of these different conditions. Now, some of you must be astonished to hear that number. But consider for a moment the incredible diversity of these brain disorders, from intellectual disability, autism, and epilepsy in childhood, through to depression, alcohol and drug dependence, schizophrenia, and bipolar disorder in adulthood, all the way through to dementia and old age. And I'm pretty sure that each and every one of us here knows at least one person, maybe many more, in our most intimate social networks who has been affected. And suddenly, this number now becomes plausible. The real crisis, though, is the vast majority of these people do not receive any care at all. And one of the reasons, of course, is that we're pretty short of mental health professionals. I'd like you to imagine that India had the same number of psychiatrists relative to its population as one might see in the US. If that was the case, we should have about 150,000 psychiatrists in our country. The real figure, of course, is a minuscule fraction of that number. Now, the reason why this fact is important is because it shows us that if we try to ape a Western model of mental health care, in which most healthcare is led and delivered by mental health professionals, we will never be able to close this huge gap between need and supply. What we need to do is to think of task shifting. The shifting of mental health care tasks from specialists to more available people in the community, just like Anjana. This is what inspired me to write my book more than 10 years ago as a way to empower community health workers to deliver mental health care. But just as with search, I realized I needed to have the courage to test my ideas, as they did, by carrying out these robust medical experiments called randomized control trials. And that's precisely what I've been doing for the past 10 years. And I want to share 3 brief examples with you of my work. The MANUS trial is the largest randomized control trial in psychiatry in the developing world. And in this trial, we placed lay counselors drawn from the local communities in primary healthcare centers to treat depression and anxiety. What did we find? Well, the results were dramatic. 70% of patients attending those clinics in which there were counselors recovered from the depression or anxiety, compared to about 50% of those in the comparison clinics. But the effects on suicidal behavior were even more dramatic. A full 50% reduction in the clinics with counselors as compared to the clinics without counselors. We've extended this model of task shifting to one of the most devastating mental disorders of all, schizophrenia. We've just completed a 3-center randomized control trial in which we were able to demonstrate that people with schizophrenia and their families who were visited by a community health worker in their homes providing a range of interventions showed far greater reductions in disability than the comparison group of families. And we have also demonstrated the benefit of this model for the very devastating condition of dementia, condition that affects older people. In this particular trial, we found that those families who were visited by community health workers showed far greater reductions in caregiver burden and also far greater improvements in the mental health of the caregivers as compared to the comparison group. Now, if I had to assemble all these different experiments in task shifting, both our experiments as well as the ones such as search, and really think of what are the key ingredients, what are the key lessons that we can learn from them, well, I've coined this acronym SUNDAR. What does SUNDAR stand for me? Well, it means that first of all, we need to simplify the message by stripping away all the jargon that medicine and in particular psychiatry surrounds itself with. We need to break down and unpack the complex interventions that specialists provide in hospitals into smaller modules, as it were, which can be delivered close to people's homes, or in the case of Anjana's intervention, even in people's homes, so that they can be used by affordable and available human resources, such as people like Anjana, and for us to then reallocate that very precious and expensive commodity of specialists so that they can perform higher order tasks such as supervision, capacity building, and providing referral pathways. For me, task shifting is SUNDAR for a number of reasons. There's, of course, the utilitarian or economic argument. It's cost effective. But beyond that, I think it's also an equitable solution because it allows us to take healthcare to people who have been historically disadvantaged from accessing healthcare due to a variety of socioeconomic barriers. It's also very acceptable. After all, why would it not be more acceptable to have a health worker visit you in your own home, especially when you have a chronic condition like a mental illness or a chronic disease which requires long-term care, and often that care isn't actually medical, but it's often psychosocial. And fundamentally, it's also because it's extremely empowering. It's empowering to the ordinary person who's transformed from being an ordinary human being to becoming someone who can help others in the community. And that you can see from the testimonies of these counselors who worked in our MANUS program. These testimonies, these narratives speak about the empowerment that these young women experience, the fulfillment in their daily lives, the enhancement of confidence, and the great sense of mastery they acquired by virtue of becoming helpers of other people. But more than anything else, for me, task shifting is the fundamental embodiment of that foundation, that pillar of community health in our country, the idea that people's health is too important to be left to medical practitioners alone. People's health must belong in people's hands. It is ultimately the example of the democratization of medical knowledge and medical power. In conclusion, friends, more than 30 years ago, our country signed on to this very visionary ideal. 12 years on, we're clearly nowhere near that goal. But it seems to me, armed with that knowledge today, that ordinary people in the community with appropriate training and supervision can play some role in healthcare delivery. Perhaps the promise of health for all is now just within our grasp. But in order for us to achieve health for all, I take it for you that we need to involve all in that journey. Thank you very much.